Democratic Party.
Thank you. Over the course of the last 8 weeks, paramedics in the province have issued a public warning that the supply of ambulances is perilously compromised. They've done this over 170 different times. That means that over the last 8 weeks, on an average of 3 times a day in at least one of the 4 zones of the province, the supply of ambulances has not been adequate because the trucks have been backed up while paramedics have waited to transfer responsibility for their patients into overcrowded emergency rooms. For crying out loud, Mr. Speaker, does the Premier not think that we can do any better than this?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the Honourable Member for bringing this very important concern to the floor of the Legislature. Of course, Mr. Speaker, we can do better than that. The Minister of Health is working with our partners. He sent a directive to ensure that we not only look at all options when it comes to the issues facing paramedics and the rigs that are on the road, and certainly the offload times that that are happening within our province, Mr. Speaker. And I look forward to hearing back from our partners through the Minister of Health about what those options will be.
The Honourable Leader of the New Democratic Party.
In the last year, for which data is publicly available, 10% of the patients at the Dartmouth General's ER gave up waiting and left the hospital before they'd ever been seen by a physician. At the QE2, the corresponding number is 8%. Now, last week, at the Northside General, they were giving out flyers to people in the emergency room who'd been there for 8 hours, telling them that it was going to be quite a little while longer yet for a wait, and suggesting they might want to come back the next morning or go over to the regional in Sydney. I want to ask the Premier, doesn't all of this indicate that at a basic level, something somewhere deeply isn't working?
The Honourable Premier.
Thank you, Mr. Speaker. The reality is, Mr. Speaker, the honourable member is laying out what is really an important issue. But the fact of the matter is, Mr. Speaker, through really over the last 2 decades, there has been no investment or transformation of healthcare delivery to reflect our reality today, not only of that of us as patients, but of our healthcare professionals and how they want to deliver these services. Mr. Speaker, the Minister of Health stood up in this House yesterday talking about the number of new physicians in the Dartmouth area that are taking 1,500 patients, Mr. Speaker. We believe that number will grow after their practices continue to expand. The issues that he highlights in different parts of the province are the reality. But I also want to tell the honourable member, so is the infrastructure that we've continued to invest in. Here in the capital region, Mr. Speaker, he talked about the Dartmouth General. We are now putting 4 more operating theatres in Dartmouth, which will have a grand total of 8. Mr. Speaker, that means if you're waiting for hips and knees downtown where you were before and something happened in our province, you'd be bumped. Well, that will eliminate that possibility, Mr. Speaker. Your surgeons will be there on time. The investments we make down here are important. And the ones that we're making, Mr. Speaker, in Cape Breton Island, Mr. Speaker, are improving the healthcare delivery model on the island, Mr. Speaker. And only those who are caught in this in a political way, Mr. Speaker, are ruining the fact and do not want us to make the single largest infrastructure investment in healthcare in Cape Breton Island, Mr. Speaker. And, Mr. Speaker, we're also hearing from healthcare providers, Mr. Speaker, who want to work in a new model.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, when you ask paramedics what is the problem here, one of the things they say is that a great deal of overcrowding in our emergency room is caused by there being so many people in our hospitals who are waiting for placement in long-term care, with the result that there is nowhere to transfer patients to from the emergency rooms. Accreditation Canada, responsible for the validation of our own health authority, says that the expansion of these, they're called alternate level of care beds, is a core component of the challenge there is around patient flow. When you talk to the seniors who are themselves living in the hospital and paying the NSHA $1,000 a month or more in order to be able to do that while they wait for a nursing home, they say that the circumstance isn't ideal for them, but they don't have anywhere else to go. Mr. Speaker, when will the Premier recognize and acknowledge that making investments in more long-term care facilities and infrastructure is a key core component of our successfully addressing the ongoing crisis in emergency care.
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the gentleman for the question. Mr. Speaker, long-term care, Mr. Speaker, continues to be on the top of minds of Nova Scotians. It is not just about long-term care beds, though, Mr. Speaker. People want to age in place, Mr. Speaker. It's why we've continued to invest in home care to provide those supports, continue to make sure that people get an opportunity to live at home as long as possible. The honourable member raises the issue about people who are in hospitals taking up hospital beds, Mr. Speaker. That's exactly why in the new redevelopment in Cape Breton, Mr. Speaker, we're doubling the number of long-term care beds associated with those two facilities. And we're building actually long-term care beds, Mr. Speaker, not hospital rooms, but long-term care beds, so they're providing the appropriate care in the appropriate place. And I look forward to the honourable member supporting that initiative that is being opposed by his party.